Hello, future doctors. Welcome back to our channel where we simplify complex medical topics for you. Today, we're diving into one of the most critical public health challenges in India, HIV/AIDS. Despite major progress, India still has over 2.4 million people living with HIV. So, what's being done to prevent, control, and eventually eliminate HIV/AIDS? That's exactly what we'll discuss today. We'll break it down into three main sections: epidemiology, prevention, and control strategies. So stay with me till the end. You won't want to miss this. First, let's look at the numbers. India has an HIV prevalence of 0.22% in the adult population. While that may sound small, it accounts for nearly 2.4 million people living with HIV. The good news? New infections have dropped by over 40% since 2010 thanks to aggressive prevention efforts. However, 56,000 new cases are still being reported annually, so we still have a long way to go. Who is most affected? Women account for 39% of HIV cases. Rising infections among women, especially in rural areas, are concerning. High-risk populations include female sex workers, men who have sex with men, transgender persons, people who inject drugs, migrant workers, and truck drivers. Geographic hotspots include high-burden states like Maharashtra, Andhra Pradesh, Karnataka, Tamil Nadu, Telangana, and Manipur. Rising cases are also seen in Uttar Pradesh, Bihar, and Rajasthan due to migration and inadequate healthcare access. HIV primarily spreads through sexual contact, which accounts for 85 to 90% of cases. Other routes include mother-to-child transmission, which can occur during childbirth or breastfeeding, sharing contaminated needles among people who inject drugs, and unsafe blood transfusions. Though rare, this can still occur in non-compliant medical settings. Now let's talk about prevention. India's National AIDS Control Organization, or NACO, is the backbone of our fight against HIV/AIDS. Their key goals include expanding preventive services for high-risk populations, improving treatment access, and achieving the UNAIDS 95-95-95 target. 95% of people living with HIV know their status. 95% of diagnosed individuals are on ART treatment, and 95% of those on treatment achieve viral suppression. Key prevention strategies include awareness and education through mass media campaigns, school programs, and targeted outreach. Community-led education focuses on high-risk groups. Condom promotion involves free distribution programs across rural and urban areas, encouraging consistent and correct use. HIV testing and counseling are expanded through integrated counseling and testing centers, offering voluntary, confidential testing services. Mother-to-child transmission prevention includes ART for pregnant women with HIV and encouraging institutional deliveries for safer childbirth. Needle and syringe exchange programs provide sterile syringes to people who inject drugs to reduce transmission. Lastly, pre-exposure prophylaxis, or PrEP, is given to high-risk individuals to prevent HIV infection, and post-exposure prophylaxis, or PEP, is emergency ART medication for recent exposure cases. Prevention alone is not enough. We also need effective control measures. The National AIDS Control Program, or NACP, run by NACO, has evolved over multiple phases. Phase 1 focused on basic awareness and testing. Phases 2 and 3 expanded prevention and treatment programs. Phase 4 strengthened ART services and healthcare integration. Today, India runs the world's second-largest ART program, providing free treatment to millions. ART suppresses the virus, improving life expectancy and reducing transmission. HIV Sentinel Surveillance, or HSS, tracks disease burden to inform policies. Mobile clinics and rural ART centers ensure wider treatment coverage. Despite these advancements, several challenges remain. Fear of social judgment discourages testing and treatment. Employment-related discrimination persists despite the HIV/AIDS Prevention and Control Act of 2017. Many rural regions lack HIV testing and ART services. Staff shortages and medication supply chain issues are common. Migrant workers often struggle with treatment continuity. Poor healthcare access affects high-mobility populations. Lack of HIV awareness leads to continued risky behaviors in Tier 3 cities and rural areas. RT adherence is a major challenge. Many patients drop out of treatment, increasing transmission risk. So, where do we go from here? India aims to meet the Sustainable Development Goal 3.3, ending the HIV epidemic by 2030. Achieving the UNAIDS Fast-Track 95-95-95 target is also a priority. Expanding research into HIV vaccines and improved ART regimens is crucial. With the right policies, better healthcare access, and stronger community engagement, India can turn the tide against HIV/AIDS. India has made remarkable progress, but the fight against HIV/AIDS isn't over. Stigma reduction, better healthcare access, and enhanced prevention efforts are key to achieving an AIDS-free future. As future doctors, you play a crucial role in educating, diagnosing, and treating patients. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more medical insights. See you next time.